Very good.
Shall we say the Pledge of Allegiance?
Yes. Pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. How are you doing today? I figured I could find you somewhere.
Welcome. All right, we'll call the meeting to order at 5:02. We've had an opportunity to review the minutes from our last meeting. I will entertain a motion to approve those.
I read those and I make the motion.
Lori, can I have a second?
I'll second it.
Thank you, Brandy. Tara, it looks like you have some health department business to discuss, including changes to the job descriptions.
So, starting, you should each have a packet. We would like to get your approval to make some changes to the job descriptions, or at least present those to the Personnel Policy Board regarding our job descriptions. This is kind of coming about for a couple of reasons. Number one, our job duties here have changed. They've been, they've shifted quite a bit since these job descriptions have been updated. So some of that, we just need some verbiage change. You will see on the front here that I did kind of make it easy for you. I attached the current job description and then notated some changes on the front. So looking at those, if you feel like you support those or have questions, I would present them on to the Personnel Committee. I think they need to probably go to Chris Hammock too, and maybe council. I'm not real sure, but I'll make sure to follow the proper channels. Corey, do you know what the exact, is it just Personnel Policy Committee, or do you know?
I do not know.
Okay.
I don't think the job description itself has to go to council.
Okay, I'll get it to the right people with your approval. The other thing that prompted some of this is, so Gail, do you mind if I go ahead and just kind of go into that? Okay, so we have 5 people that are currently employed here full-time. Gail is employed full-time by our immunization grant, and we were made aware recently that immunization funding is being drastically cut. Gail has announced her retirement as of June 30th. We are so sad, but she picked a great day because her grant ends on June 30th. We will be getting immunization funding, but it is just for reference in so the current grant that we are on, we got $116,000-ish. We asked for $86,000. They gave us an extra $20,000 to purchase new refrigerators. This year we are getting $4,000. Part of that, I believe, is because we have Health First Indiana funding, and we are working very hard with immunizations in that funding. So part of that kind of does make sense. Part of it is that there have been drastic cuts to, several items. Immunizations is likely one of them. So my request would be that we are going to try really hard to proceed forward without replacing Gail. We feel, talking amongst us and really going through everything here, we have such a good support staff with Patty and Tamara. We are fortunate enough that they are part-time, grant pay, Patty is paid through Health First Indiana. Tamara's paid through our BP grant. They support us fully. If we did not have them in those positions, we could not even think about not replacing Gail. But that is part of where the job description changes come into play. Some of those duties came from Gail's job description. And reshifting things here at the health department. I have taken on a lot more administrative duties, budgeting duties. So it kind of, some of those shifts you will see on there. Mallory is the #1 immunization. She's the immunization queen, whether she wants to be or not. So Danielle's job description, Mallory's was pretty dead on. Her job description was very good. There were no changes that needed to be made to that one. Danielle's needs to be changed, and then mine needs to be changed as well. So, like I said, if you don't mind to review those changes and then let me know if you do approve them. If so, I can push forward with those with the right people.
Any discussion?
I'll make a motion.
Corey make a motion. I'll second that.
So the second item on the list is update to HFI employees. Most of you probably already know this because if you watched the council meeting, and I know most of you have read my emails and responded to that, so thank you. Patty, our school liaison, and the open position for our sanitarian assistant, they were converted to part-time county employees. The proposal that we had in the beginning of the year was to make the sanitarian assistant full-time, and then with some updates with the county attorney and some discussions there, we made the decision to just keep him part-time, keep that place part-time, and then change the pay just a little bit so that we were able to keep it within the budgeted amount within HFI. So that was approved. That position has been posted. If you guys know anybody, please send them our way because Kim definitely could use, some help in that position. Upcoming events. So we have our baby shower next month, April 17th. Again, I think I sent out the flyer to everybody. I don't know if you guys have it posted in your office or at the courthouse. If you guys could get that posted, that would be great. We do have community partners that have committed to being here. This year, MD Wise did contact me and wanted to know if they could please partner with us. They partnered with us last year for our immunization event. And when they partner with you, what that means is sometimes they provide like a food truck, and they really just provide support by sending out notifications to their members and anyone with Medicaid saying, hey, this event is going on near you. So we did go ahead and say, yes, please, let's partner with you. And MD Wise called last week and let me know that they will no longer be partnering because they are not able to. They have lost the ability to go out and do events. So we are worried, because we know that funneled a lot of people in here last year. So we have the billboard up. We're advertising that way. We've gotten flyers out. So if you guys can help us advertise that and push people to us, that would be great. We also have tons of immunization stuff coming up, back to school. It's hard to imagine that it's March and we're already talking about back to school, but that's what we thrive on. So lots of stuff this summer, back to school, immunization bashes. We have been in the schools already for kindergarten roundup at Cannleton and Tell City.
Yeah.
Patty works very heavily in the schools every week. Patty, how many vision and hearing screens did you do last week? Like 100?
Almost 200.
Almost 200 hearing and vision screenings. So
No, that was just here.
that was just hearing.
Yeah.
Yes. We are going in a couple of weeks to Tell City and Perry Central to do their physical night, which is a great service. I think,
I'm going to both,
yes. So
7th and the 22nd. I think.
yeah, that sounds about right. So we will be there too. So yeah, lots of events coming up. I'm sure you guys have seen on Facebook, we have been going in doing dental education with the daycares and things like that. So we've had a good feedback about that too. They seem to like it. Everybody got bike helmets. They had a good time. Is there anything else? Resource fair, that'll be towards the fall, but we'll keep you guys all posted. But if you could help us advertise that baby shower, that would be great. Changes within immunization grant and HFI. We've kind of talked about that a little bit. So just to kind of reiterate, our immunization grant pays the immunization coordinator's salary. It also gives immunization dollars to the other staff in the office, not the sanitarian, but it's myself, Mallory, and Danielle. With the, we have always planned that if that stopped, how would we continue our immunization hours, endeavors, all of the work that we are out there already doing. And we had written that into Health First money. And it was approved by council, of course, in the fall. So effective July 1, we will go on to Health First Indiana with our immunization endeavors. The $4,000 that we, will get from the state, we would love to change our check-in process to a digital process. We have been talking with Ann Island briefly about what that would look like. Everybody seems to be digital, and I know it would save patients time when they check in if we could pull up, like, hey, you've already been here this year, just update whatever you need to, rather than having them fill out 3 pages every single time they bring every single child here. So we felt like that would be it. If we're able to get that covered and, under that $4,000, we would like to take a look at that and see what we're able to do with that. Of course, I will go in front of the council and let them know, everything that is going on as well, since we do not plan to, we're going to try really hard to not replace Gail. It will be difficult, but we have a good group. If we didn't have a good group, probably be in a different situation. But we are going to try very hard. And I feel like it's a good, from a council standpoint and a good steward of funding, it's like we are trying to change job descriptions and kind of revamp certain positions so that we can try to press forward without Gail. So I think that's all that I have. Does anybody have any questions? Do you guys have anything additional to add?
Any other business that we need to discuss?
Is there any update on the drive-through?
There are no updates on the drive-through. But to be fair, I have not taken it to a meeting. I have mentioned it in passing a couple of times. I would welcome assistance with that. If anybody here wants to, Brandy, just so that you're aware, the health department has funding that can be used strictly for public health. It has to go back into a public health activity of some sort, but it's not super strict, just must, help with public health activity. So what we would like to do is have a drive-through. We've thought of several different ideas on how that would look like. We're not really picky. We just want it to be respectful to the other offices here in the building. Our tent is in rough shape. That is our second tent that we have gone through, and it will, if we do not have a more permanent drive-through, it will not go up this year because it's not useful. But for reference, from mid-September to Thanksgiving, we pushed through 1,600 people in that drive-through, and they love it. So our thought is we could use it for immunizations. We could use it for, our health screenings. We could do drive-through health screenings, but also our car seat checks. Danielle and I are currently doing car seat checks in the parking lot, and kids are out of their car seats and they're running around in the parking lot, and it's just not a super safe situation. So that definitely, needs to be addressed as well. So if anybody wants to help me, discuss that further, we can.
Do we need to do any campaigns with respect to the growing number of active measles cases across the country?
Yeah, so I have been talking with IDOH often, and I know Vanderburgh County just put out the parameters for seeking vaccination boosters, and we kind of piggybacked off of that. We have gotten several calls, and we've kind of explained the algorithm that we follow. But yes, we could definitely share more of that. If you have any ideas, let me know. Facebook is usually where I put everything. We do have a lot of people that call, though. We've answered a lot of those questions, and we've vaccinated a few of the ones that fall within that algorithm. So, but yeah, I've just been encouraging people to call us so that we can look up their date of birth, their vaccine record, and just kind of make the best decision for them.
Yeah.
Where do we stand on our dog bite situation? I know there was some
Yeah.
discussion that the county and the city ordinances are not congruent and
Sure. So obviously Kim deals with our dog bites. She cannot be here tonight, but I know that she's in the process of formulating an email with everybody at the table so that we can hopefully get everybody on a more similar page so that, it's not, well, the city has this ordinance and the county has this ordinance, and how do we make sense of where we are and, what is appropriate. So that is definitely an email that she will be sending out, just so that everybody can kind of help you on the same page.
Anything else anyone needs to discuss today? Well, then I will make a motion to adjourn the meeting at 5:17.
And our next meeting is June 5th, 5 o'clock here.
I will not be present.
I do need a second to my motion for adjournment, please. Thank you.
Okay.